Do you realize it's safer to live in war-torn Ukraine with Russian bombs raining down than to be admitted to a hospital in London or New York? A British ambulance takes in excess of 1 hour to respond to an emergency. 10 million people die from cancer worldwide every year. 42,700,000 suffer harm as a result of medical errors. 15 million people died from the COVID pandemic. Our society is sick. Nearly 3/4 of Americans, 65% of Canadians, 35% of Australians, and 24% of Britons take some form of prescription medication. This is the ultimate evidence of a broken healthcare system. What happens daily in our hospitals is equivalent to 9/11 or 10 jumbo jets falling from the sky. Imagine how we would react if a jumbo jet crashed every single day, let alone 10 jets crashing every single day. We would never tolerate such events in any other industry. Why do we tolerate them in healthcare? In the most technologically advanced period in history, why do so many people die or suffer harm while visiting their healthcare providers? The death of 15 million people in this most technologically advanced period of human history illustrates the failure of our healthcare system. However, there is hope. The development of the COVID vaccine proves we have the capacity and skills to reform our healthcare system. In Rethinking Healthcare, I present a comprehensive analysis of the flaws in the healthcare system. I explain how healthcare delivery can be improved to keep pace with medical science and diagnostic technology, to improve patient care and provide better working conditions for healthcare professionals. Today, the fundamental problem in healthcare is the massive gap between medical science, advanced diagnostic technology, and healthcare delivery. Medical science has advanced beyond our imagination, while healthcare delivery remains frozen in the 19th century. In the Rethinking Healthcare book, you'll learn the flaws that exist in the healthcare system, effective strategies for closing the gap between healthcare delivery and medical science, detailed analysis of the causes of our broken healthcare system, effective strategies for reforming healthcare. Healthcare reform requires healthcare professionals and policymakers to change their mental models of healthcare. The major barrier to healthcare reform is a mental model that's rooted in the past. A mental model that provides a binary choice between saving COVID patients and allowing other patients to die is incompatible with the objectives of a compassionate healthcare system. Additionally, each of us as healthcare consumers must change our perceptions and expectations of healthcare. In the book, Rethinking Healthcare, we encourage you to join the campaign for healthcare reform so that war zones can no longer be safer than our hospitals. You should keep in mind the possibility that you or your loved ones may find yourself lying helplessly in a hospital bed someday. We'll all become ill at some point in our lives. The last thing you want when illness strikes is to be treated in an environment that's more dangerous than a war zone. To avoid such a fate, support the campaign to make healthcare safe by pre-ordering a copy of Rethinking Healthcare from Amazon or your favorite book retailer to donate to the healthcare reform campaign. You may be saving your life or that of a loved one. As a token of our appreciation for your donation, when you donate by pre-ordering the book and email a copy of your receipt to info@romeorichards.uk, you'll receive the following rewards: the 100-page summary of the 4 books, currently being sold on Amazon for $11, Chapter 2 of the book, and a VIP membership to the Healthcare Reform Campaign.